institutions are not just hospitals, they are movements. They set benchmarks for ethics, equity, and excellence, and most importantly, they touch millions of lives. The LV Prasad Eye Institute is one such extraordinary institution. Through this special conversation, MOS takes pride in bringing to you the inspiring journey behind this remarkable legacy. From a visionary dream to a global model of excellence, from challenges to transformative impact, and from a strong foundation to a future that continues to inspire. Today is not just an interview, it's a journey of vision, courage, and commitment that transformed eye care in India and inspired the world. And when we listen to such journeys, we don't just hear history, we find direction. It is our honor and privilege to be in conversation with two stalwarts, the visionary who built a dream into reality and the leader who is taking that dream into the future. On behalf of MOS, we warmly welcome two towering personalities who have not only led but lived the vision of LV Prasad Eye Institute. A warm welcome to Dr. G.N. Rao, a visionary honored with the Padma Shri, a pioneer and the founding force behind LVPI, whose dream transformed into one of the most respected models of eye care in the world. A warm welcome to Dr. Prashant Garg, the present Executive Chair of the LV Prasad Eye Institute, a distinguished clinician and a great academician and leader who continues to carry this legacy forward with excellence, innovation, and compassion. Before we step into this journey of conversation, a brief introduction. I am Dr. Anaga Herur, President of the Maharashtra Ophthalmological Society, and it's a privilege to be a part of this dialogue. I am joined by my co-host, Dr. Aditi Watwe, an accomplished oculoplasty surgeon and a fellow of LVPI, bringing with her both experience and a deep connection to this institution. Together, we look forward to exploring this journey with our esteemed guests. A warm welcome to both of you once again.
Thank you. Thank you very much for the opportunity.
Our pleasure and honor, sir. Dr. Rao, please take us back to the beginning. What was the defining moment or inspiration that led to the creation of LVPI?
I think there is no one moment before starting the LV Prasad Eye Institute in Hyderabad. I lived in the US for 12 years. The experience there kind of inspired me. I saw what is possible. And then the question came up in my mind, why can't we make that possibility possible in our country too? So that was something that struck me. Initially, when my wife and I planned to return, there was no big idea of a center or an institute. But then as the day came closer, we have decided if we were going back, it would not be a routine practice. We should do something differently. Then the idea crystallized into the shape of an academic eye center along the lines of the best of the American centers, where there would be clinical care, education, and research, to all of which I had the privilege of getting exposure in the US. So that was the idea, to come back to India, start an academic eye center, but only with one caveat, something that is not practiced in America well, that is equity.
Yes.
To make our care available to everybody,
Absolutely.
irrespective of their ability to pay, if they come to us for care. And however complex the problem is. And we've been very fortunate that over the past 38 and a half years, we've been able to practice that very effectively. And then a couple of years later, the idea struck, why don't we make it more comprehensive? When I began to learn the word comprehensive eye care, that would encompass prevention, promotion, diagnosis and treatment, and then rehabilitation. So we added the component of rehabilitation. That's what it was.
Yes, absolutely. Was there any gap in eye care at that time in India which actually made you go ahead with this? Was there any gap that you found?
I think the main gap was India had lots of gaps in those days, in the 1980s, both in quantity and quality. To some degree, that exists even today, even though it has improved significantly. And our aim is to create a model of high quality, a care that is available to everybody. At that time, there was no idea of this great network or what we have become later on. It was simply an idea of one center in Hyderabad, combining excellence with equity.
Precisely to that, coming to that point, why did you initially choose a not-for-profit organization with pyramidal model when for-profit and conventional hospital could have been a easier way? Maybe you could have still given the clinical excellence and service to the patients with excellence.
Yeah, that's good. I think I could have become a billionaire these days. His IPOs and all that. But somehow my wife and I felt very strongly, even in a poor country like ours, we got the best out of this country. And it's for families like us to give back to our country. Even with what we have, we are better than 99.9% of Indians.
Yes.
Whether it has to be brought down to 99.9999 or 99.9 is sufficient was the question, and we thought we would be happy with just being at 99.9. So the important thing was, when there was so much suffering, so much health problem, so much blindness, we have to do something about it. And also fully realizing we can't solve the entire country's problem. We could only create models.
So in early days, did you ever felt 1% of fear that this dream may not succeed, or the way which you have chosen may not be the way to go?
No, there was no fear. We came with the full determination that we will give our 100% and try very hard for 5 years. And if we didn't succeed, we would have had at least the satisfaction of having tried and failed.
At least, right, absolutely.
And we probably would have gone back after 5 years if it didn't work out.
So what were the biggest challenges at that point of time? Like, was it funding? Was it manpower? Was it mindset of people?
Contrary to popular belief, funding is not a big problem in India. Funding was never a problem at that time. Funding has never been a problem throughout these 38 years. Whenever we thought of a program, a new idea, somebody came and supported us. So there is plenty of support available if we have good causes and good ideas. The challenge then, and continued throughout until now, is getting well-qualified, competent human resources and people with standards and alignment with our values.
Dr. Garg, at that point of time, were you a Cornea Fellow at LVPI?
Yeah,
You
so
were
I
already in LVPI at that time, right?
Yeah, so I joined for a short period, that is 3 months in 1993, and made a determination that I'm going to return back. In 96, I joined as a long-term fellow, and then after that, I am part of this journey.
What was your experience at that point of time? Was there anything specific that you would like to share now?
So I think what I liked the most, because I grew up in a universities and academic setting, the rigor of academic activity happening here, plus the discipline and that apart freedom to work and share your knowledge or exercise your knowledge. That was the three components that I liked the most, and possibly are still very unique to our organization. Even today, every faculty member has a freedom to practice the most modern ophthalmology. Even today, they have a complete freedom that to patient who cannot afford, they have a freedom to waive off charges. They have a freedom of choosing the area that they want to choose and specialize or publish extensively. So there is no that
Restriction.
we are working for a vision of a one man. Every one of us have a freedom of
It is
having
really
our own
amazing.
vision within the larger vision of the organization and continue to work.
Did that really help you to build the trust among both patients as well as professionals? This openness
It still continues to
still
to
continues.
motivate me, and that is precisely the reason that I got motivated to work on corneal infection and then kept on growing in that area. I was given opportunity to lead eye bank very early in my career and continue to nurture that part. By 2005, my another passion of education, I became head of education and continued to not just enjoy the education part, giving knowledge or sharing knowledge with other, but also creating strategies and so I think those pillars still continue to drive the way I think and the way I want to see the future of the organization.
What we try to do is to emulate the best examples in the best centers of the world and make them locally appropriate.
And such a dedicated team, I think that was one of the most important foundation. Absolutely.
The two things we put together, one is 90% of our colleagues in all cadres are dedicated and work very hard. And the friends from all over the world have helped us to build the organization.
I think this is a very
We
strong
just
message
put
to
the,
all our members.
yeah, we just put these two things together.
Yeah, the dedication and hard work. Absolutely.
That worked for us.
Yes.
Was there any specific turning point which actually defined the journey, like maybe after starting or just before starting? You were mentioning about early 5 years when you were like trying and making your dream come true.
The first 5 years, as you know, Aditi, we have seen it here. Our culture is so different from the rest of the country and rest of the organization. So we are somewhat alien in what we do. And first 5 years, we worked very hard to build that culture, to build our values, and instill the practice of following those values in every one of us. And that has helped us. While building the center in Hyderabad, we built the values the first 5 years. The second 5 years, we brought in other components. And in the first 5 years, we also brought in education. Education actually started even before we saw the first patient. In the neighboring Prasad Film Laboratory auditorium, we used to conduct journal clubs for the local ophthalmologists while building is being built here. So, and the research started from day one because as like in American university medical centers, we made it a point that every medical record has detailed documentation. That way, each record automatically becomes a research document. So the clinical research started from day one. So all three components, patient care, education, and research started from day one. And then the practice of excellence with equity also started. On the very first day, we saw 4 patients, 2 paying and 2 non-paying. And by the way, Anaga, the initial years, the biggest support came from our patients in Mumbai because most of our high-paying patients came from Mumbai with many friends referring their patients for corneal transplantation to me.
Yes.
So they all knew that I was returning and starting the center. And as soon as the services started, they started referring their cornea patients.
Great.
So that's how it started.
Great. It's amazing, sir, to see how LVPI has organized its eye care services in different levels. So even the poorest and people in the most remote locations also have access, and they can also have access to the advanced eye care. So how would you describe this pyramidal model in simple terms? How does it work?
So the idea is, it started, I never wanted to go anywhere. I even used to tell anybody asking, no, we are not going anywhere. We are just here in Hyderabad. Rural areas, people are doing camps, let them continue to do it. We have no intention to go there. But then as 5, 7, 8, 9 years went by, we began to see the complications coming from rural areas. And then there was also encouragement and pressure from some of the friends in the international NGO sector saying, hey, Nag, what's the big deal you did in Hyderabad? You show us you can do it in rural areas. So they kind of taunted me. And I think together, then we thought, then a friend from one of the remote areas of Andhra Pradesh, coastal Andhra Pradesh, approached me asking for help to build a secondary center in his village. They were already doing it, whether we could help in building it. So I told him, I have no idea how to do it, but I'll give my 100% and help you. And that experience moved us to go ahead and start our own thing. And once we decided, we wanted to go to the remotest and the poorest village in the whole state. And that's what we did when we went to a village called Mudhol in Adilabad district of Andhra Pradesh. Now it is Telangana. At that time, it was combined Andhra Pradesh. And then that went well. And Mudhol, everybody said it's going to fail. You are a fool, wasting money. It will never work. But last year we saw, I think, 60,000 outpatients there, about 8,000 or 9,000 surgeries, more than half done at free of cost.
Yes.
And then we are operating expenses, cost recovery was more than 100%.
Wow.
And that entire district, today there is no cataract blindness.
Wow.
So
Been
then,
to, I was posted in, sorry.
after the first one, then the whole thing started. We kept on building more and more. So it has become an infection. And then a few years later, we thought even with this, we are not able to really reach the remote, rural, and tribal. How do you take high quality care to those areas where nobody cares? So that's when we thought of the concept of Vision Center. A small center rented or gifted by the local community, where it will be staffed by local kids who completed intermediate or class 12, trained here with us for a year or two, and put back in their own communities, providing primary care. And one of the greatest areas of gratification for us to see how these kids blossom in their careers, given their opportunity. And that's how we started Vision Centers. Same quality equipment, Same thing. We may not do everything that we do in Hyderabad. Whatever is done there will be done exactly the same way. That was the principle. So that's how the primary care started. Actually, even though we didn't call Vision Center, the first primary center was in the urban slums of Hyderabad in 1992, within the first 5 years. And we had the rotating optometrists going there and running that service. So that's how the Vision Center started. And then it replicated, multiplied. Now we have close to 300 vision centers in 3 states. And just the other day, I got a number from research by one of our colleagues. I believe around the world now we have 68,000 or so vision centers scaled up by multiple organizations around the world. I was surprised when I was in California a couple of years ago in a shopping mall. I saw Walmart Vision Center. When I saw that, I thought I made a mistake of not having a patent on that. So that's been the journey. And the key here is earlier in government sector, they had primary center, they had district hospitals and all that. But the big difference is the integration. 10 vision centers are linked to a secondary center. Secondary centers are linked to a tertiary center. It's all one whole unit.
Correct.
And at the top, the tertiary care is looking after the entire network. So that integration is key to success. And more recently, what we found out with our studies is that if we have high quality vision centers and a secondary center attached to it, 85 to 90% of patients don't have to travel anywhere else.
Yes.
And our institute's vision now is, in the next 10 years, how do we create a system where everybody gets the access to high quality eye health within 50 kilometers of where they live.
And the blessings of all those thousands and lakhs of people have now helped LVPI grow even higher.
Absolutely. Yeah.
Yes.
And I think Prashant has been leading the institute for the last nearly 5 years, and his team, they all work very hard, very bright people, and they are taking it to the next level and into the future.
Absolutely, absolutely.
And equally,
With all these centers and different places, how do you actually ensure that in presence of equity, it is not compromising the excellence?
yeah, we have, maybe Prashant can answer that.
Yes.
So I think what it requires is having these excellence, equity as part of the culture of the organization. So we made sure that these are not just the values which are limited to a segment of the organization, but in all our activities that we are involved with, to ensure that we are not compromising on both the excellence and equity. We spend our resources to the training and retraining of our team. We also have a strong monitoring system, audit system, as well as providing timely feedback to all the people who are involved. We also demonstrate our commitment by bringing forth all the examples where we see that there is an excellence, be it at tertiary center or quaternary center or vision center. Many of our monthly newsletters very elegantly capture the good work which is happening in the community level, not just the scientific excellence. So I think with having a strong system of that your human resource is aligned to the values, you are monitoring, auditing, and providing feedback, and then reinforcing these values, we are able to sustain this equation or reconciling excellence with equity.
So are there some set SOPs that are given which need to be followed at every center?
Yes.
And they need to follow those SOPs, and then they are audited as to whether they are following it or not. Right?
Yes,
Is
so
it
that was,
something like that? Yes.
yeah. So even at a vision center, if you go, you will find that our vision centers have the same quality of equipment as are present at quaternary
That
centers.
is really amazing because, to get that same kind of excellence across the zones in the pyramid is really amazing.
Mhm.
I'll
Now
tell
that
you, I'll share an anecdote with you related to Vision Center. Many years ago, we applied for a grant to an American agency called LDS Charities. This is a Mormon church. And they have sent one of their volunteer working with LDS, who happened to be an ophthalmologist from San Francisco, to verify our claims, what we said in our proposal. So that gentleman came and he was sent to one of our vision centers about 200 kilometers from here. He went there, the vision technician there was a 20-year-old girl, and he watched her throughout. She took the history, she examined the patient, visual acuity, slit lamp exam, applanation tonometry, undilated fundus exam, all that she did. And he was watching all that. And at the end, he asked her, what do you think the patient has? The patient came with the complaint of night blindness, young person, 20s, in their 20s. So without hesitation, she said, I'm not allowed to dilate pupil. From all the history and from whatever I could see and examine, I think this patient has a retinitis pigmentosa. He said that blew my socks off. A third-year resident in many American residency programs wouldn't have been able to make diagnosis without dilated fundus. And he said that convinced me our LDS should support your organization to the full extent.
Oh, great. Absolutely.
So these girls and boys are so bright. If you give them the opportunity, they just blossom.
Dr. Garg, now that you are leading LVPI now, what are the differences in the challenges that you face now compared to what it was, say, 20 years ago?
Her son is not a challenge, right?
Okay.
With expansion and with the scale that, sorry.
She didn't. I said her son is not a challenge, right?
He's in Mudhol, right?
No, I think as the organizations grow, some of the challenges start appearing. I think one of the major challenges that we see is really getting human resource who is aligned to our values. With the increasing urbanization, with many people moving into urban areas and possibly want to live in urban area, people are not very keen on going into the semi-urban or tier 2 or 3 towns. And number two, I think the adherence to our values and that becomes another challenge. We need to spend extra energy on really talking about that, how these values are sustainable in the today's world where everybody assesses the healthcare performance on different indicators than what we assess in our organization. I think the second challenge that comes is to ensure that the quality standards remain same in every place that we operate. Today, when we are present in 320 locations, our goal is that whether the patient is seen in the remotest rural area or at quaternary, their overall experience has to be very satisfying and enriching experience. So that becomes monitoring and auditing those systems become another challenge. The third challenge is imposed by the desire to embrace technology. And I think what happens at one end, the technology is growing at a very rapid pace. You want to keep abreast with that. At the other end, your priority is to serve patients. So how do you balance your the incorporation of technology into the system, at the same time ensuring that it does not compromise on the services that we have to offer to people who cannot afford that. So I would classify these challenges under these broad three headings.
Correct.
But otherwise, we are very fortunate. The people who join our organization are 90+% of people are very aligned with the value, and they very much appreciate that this is the organization that does not deny care to anybody who walks on our campuses, regardless of their ability to pay or complexity of the case. So that way, even a counselor feel very confident in talking to them and saying that you don't
Yes,
worry.
we will do it for you. Correct. Right. Absolutely.
I
So-
think one of the keys is that we always do our very best to take care of our people.
Absolutely.
Care for them. We see that they're moving upwards in their careers. And if somebody is exceptional and that talent is identified in any individual, they get an accelerated promotion. They don't have to move one rank at a time. They can straight jump to the top. And Prashant himself is an example.
I was about to say that. We can see how great. Yes. So basically, LVPI from an institution got transformed into a movement. At what point of time do you think that transformation happened? Because all the people working here have been focused on the work and the dedicated efforts. But automatically, all this happened, and today we look at it as something which is inspiring all of us. So, at what point of time do you think this actually happened, this transformation?
I think this happened with the gradual increase in the number of our trainees coming from different parts of India and different parts of the world. And when they go back, the practices they carry, the culture they carry is making a difference in those communities to some degree. And the second is the capacity building programs through which we work with many organizations around the world. And the third is collaborators around the world. So
Right.
cumulative impact of all these factors make this happen.
Dr. Garg, how did you combine the culture of clinical excellence along with research? Like Dr. Rao already mentioned about it, but how do you continue to maintain that amount of work with the research?
I think this habit is inculcated right from the time that they join us as a trainee. Every trainee is given an exposure of not just the clinical skills, but also an experience of how the research is to be conducted and how the research is to be shared. The new knowledge has to be shared. In addition to that, every faculty member is given 1/3 of their time dedicated for carrying out research. In our morning classes, grand rounds, as well as during clinics, we encourage clinicians to identify problems. And these problems then become the topic for their research. The second important component is the ecosystem that Dr. Rao has created. The research faculty, the clinical faculty, optometry faculty, public health people, they all sit together in the morning classes. We do not have these different groups as separate entity, but a part of the common ecosystem. Our research facility is available within the same area where the clinical facility is. There is ample opportunity for people to interact with the research group, with interdisciplinary, the cornea group interacting with glaucoma and retina. And all of these interactions are generating interesting questions that they are able to. We also have the research facility, which comprises of basic laboratories for genetics, for cell biology, we spend close to about 20-25% of all our annual budget onto the research activity. So we constantly are upgrading our research system. The other advantage we have is that we have strong collaboration with the basic science laboratories in the towns where we are present. For example, in Hyderabad, there is a very good ecosystem. We have collaboration with Center for Cellular and Molecular Biology, National Institute of Nutrition, Center for DNA and Fingerprinting, IIT Hyderabad, then BITS Hyderabad. So that ecosystem also encourages people to go out of the institute and collaborate with the scientists in other organizations. In addition, we have a visiting faculty program. Many international friends and experts visit us periodically, and our faculty as well as trainees get exposure to the benefits of how combining clinical care or clinical excellence with research is going to help build their career. So they are role models for many of our faculty and handhold them, mentor them, and that gives them enough encouragement to continue to combine research and clinical
I
excellence.
totally agree on that because like I've been a part of LVP more than a decade back, but still that inculcating those research questions and the thought process during your training really shapes your thought process even in your solo private practice. Even like while doing exclusive oculoplasty solo private practice, not in a metro, I still think about what is different. I should document everything, photographs, the clinical records and everything. And that really changes the approach is what I've experienced in last few years. In fact, Dr. Rao was also there. This AIS LDP debate also, I was given the same topic about inculcating research in the solo private practice versus keeping it only for the institutes. So LVP being one of the very few institutes which actually has only the clinician scientists who are working together. What is the secret of nurturing them? How do you actually work on them? You have mentioned about the labs and rest of the things, but keeping them with you, keeping them motivated and making the research happen, not only from publication and numbers, it's actually research which is contributing to the science. How do you nurture all these people and the thought process?
I think just to create an enabling environment. It's not only labs and all that. Right from day one, we have a library which is open 24/7 and available to all ophthalmologists in the city, not just our people. We have science writers helping to polish your manuscripts and help with the language. We have biostatisticians, everybody, all the support structure is there. And we tell the faculty, you identify which area you want to pursue as your interest area. And you run with it. We are behind you and we'll support you 100%.
Yes. And
See,
in
one
this,
of the
please go
one
ahead.
of the motivation is that we, to all the clinician scientists or basic scientists, we always support them in initial year before they can secure grant. So that funding, they have not to start thinking about what will happen if my funding is not there. So that's one thing. The other is that when we talk to basic scientists, most of them feel that the close working relationship with clinician is a biggest advantage most basic scientists do not have.
Correct.
If they work in the basic science lab, they may do discovery, but they are not able to understand how that discovery is going to change the lives of the people. Here they are able to really see how their discoveries are making impact on the ground, and that keeps them very motivated also.
So true. So, which areas of research do you believe will define how it happens in the next decade? Which would be the areas of research?
So it's a very rapidly evolving area. I think um, so far what we saw was the research which was trying to unravel the pathobiology of the diseases, probably looking at new drugs and other things. But the coming 10 years, I am very sure that the research is going to focus around the large data that we are generating and how this large data can be leveraged in order to understand the diseases, their pattern, the treatment outcome, and possibly will be the key driver as far as the new information and new practices will come. The second area that I'm very optimistic is the regenerative therapy. I think we now understand that, say, genetic diseases or the terminal uh, 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 diseases where the tissue is almost damaged, we can replenish those by the cells and the tissues grown in the laboratory. We have part of one such study where the stem cell for retinal degeneration, we are seeing that that looks a very uh, a therapy which will be a reality in near future itself. Similarly, there may be many more opportunity for mesenchymal stem cells, pluripotent stem cell. You can even edit genes in patients suffering with genetic diseases or inherited eye diseases and correct the disease process. So that will be the second area. Third will be public health. Today, the entire world is struggling with the access to healthcare. Even in United States, the Vision 2020 USA is looking at how do I take care, say, 100 miles away from the metro city because they are not able to come to the cities or they have to face the long waiting time to get appointment. So the public health and use of technology is going to transform a large part of eye care in the next decade, and therefore a lot of research will be published in that direction as well. The last area that I am optimistic is in the vision science field. I think how do you rehabilitate or restore sight for people who are suffering with the irreversible vision loss and blindness? And you see already people are working on using audio signal into using smart glasses that are able to give them wider field of vision and other things. So that is another area that is going to be attractive and very meaningful as far as the next decade eye care is concerned. Is there anything that I have missed and you would like to add?
No, I think people are thinking of some audacious ideas and working on it for the past probably 10, 15 years, but the progress has been slow. Maybe it will accelerate is whole eye transplant.
Okay.
So with better understanding of biology and regeneration, then maybe in future that will become a possibility. And of course, I personally believe the best way to provide care, we use the 3T formula: talent combined with the technology and tenderness. Tenderness is the caring element that a healthcare professional is supposed to provide because you are getting people who are in distress.
Yes.
So what kind of care do you give them to relieve their distress? So technology, I believe, if it is controlled by talent, you get good results. If it is the other way around, you'll be in trouble.
Yes.
That's what we have to watch out for as we move into the future. Already technology, as you see the world war and all, is creating a major havoc in the world. Total confusion.
Dr. Rao, LVP has surely touched millions of lives, like from the doctors, consultants, trainees, patients. I am one of those all million people. So what does it actually mean to you personally? Any specific incidents or something which you would like to share with us?
No, I think I feel very gratified what we have tried to do has actually happened to a large extent. We can certainly improve, and there is always scope for improvement in everything that we do. But it's been a very gratifying journey over the past 40 years. And even in my wildest dreams, I never imagined that all this would happen.
You're blessed. And we
Yes.
are blessed in turn by interacting with you.
Thank you.
Dr. Garg, with so many consultants and trainees, fellows working, Dr. Rao mentioned about tenderness. How do you ensure that there is that compassion that remains at the heart of care in everybody? I mean, this is not taught to us in medical college. They teach us how to diagnose a problem, they teach us how to perform a surgical step, they teach us how to use equipment. How do you teach compassion? How do you inculcate that in your trainees and fellows?
I think the foundation for compassion is laid right from the time somebody joins the organization. Right? They can see the moment they walk inside the premises, the way our security team greets them, the way our housekeeping is keeping the premises clean, the way every employee greet and talk to patient, that itself has created an ecosystem that they can feel the difference. More importantly for us, whenever we are evaluating or assessing the performance, it is not the clinical excellence that is assessed. The demonstration of compassion is one of the criteria for anyone to remain in LVPI. In every encounter and to everyone, both our inside colleagues as well as to anybody who is coming, including even our vendors.
So heartening.
So they are able to see and they know this is one of the performance indicator. Then not taking care of the dignity of the patient is unacceptable. We call it as a non-negotiable, and that is very clearly articulated. Right from the community health worker going into the community to the quaternary center, from security to the chairman, everybody understand this value very well, and that's help us to continue to nurture that, because in the ecosystem where everybody is following that, it becomes relatively easy. Yes, I think this is one of the challenge that we face whenever people join institute who have no prior experience. How do you inculcate them and monitor them on these values, and these is one of the challenges that we have, and we strive to ensure that they demonstrate, they acquire that behavior.
One of the examples of treating every patient, paying or non-paying, with
Correct.
dignity and respect is we don't have you can never address a patient tum.
Correct.
It always has to be up.
Ah,
Whether it is the poorest of the poor or Mukesh Ambani or Narendra Modi, it doesn't matter. They all have to be addressed up.
I'm truly overwhelmed actually. I mean, they say Yatha Raja Tatha Praja. So when it comes from the top, then it trickles down the entire line. It's
And we
really very
and
heartening to know. I
and
think
we
this
believe in the
message should
philosophy.
go to each and every institute also, as well as each and every ophthalmologist. Sorry, I interrupted you.
So we say patient is the only VIP.
Oh,
For example, one of this is manifested or shown, demonstrated. For example, the closest parking spaces to our building are for patients. The staff and faculty have no reserved
oh,
parking, and the
that's
chairman has no reserved parking. And he can't
Really?
park his car under the portico.
Oh my God.
Patient first, in every sense of the word.
Now, this question is for both of you, Dr. Rav and Dr. Garg. What gives you greater satisfaction, patients treated or students trained?
Difficult question. Both, I would say. They're both important. Now, students trained is equal to
Aditi has
patients
put a
treated.
very difficult question.
Yeah, she's getting back to us.
Absolutely no. So it has been like more than a decade since I got trained in oculoplasty department at LVP. So Dr. Garg, what changes have been made in the training? Because as the time changes, there are few things which we need to change, maybe add or maybe omit. So what changes have been made to make the things more relevant for today's era?
I think one of the things that we observed was that there is a wide variability in the standard of residency training program. And we realized that uh, the exposure to comprehensive ophthalmology was missing among the many trainees. And therefore, what we did is that we created an opportunity for ophthalmologists who are coming from the uh, uh, programs which are not robust on those areas to get exposure of the comprehensive ophthalmology in first 9 months and practice it over 1 year period before they start their subspecialty training. And the positive impact of that has been that they are able to progress much more rapidly and they are much more confident when they join the subspecialty rotation. And they also have a good foundation of comprehensive, despite they coming from program where they had no exposure in that area. So that is one change that. Number two, we have also started in employing a lot of technology into the training so that they are taking much shorter time. For example, we now have good simulators for cataract training. So they can practice as much as possible and have very good hand-eye coordination, hand-eye and foot coordination and other things. The second change is more about the methodology. We earlier used to have only one grand round. Now even the subspecialty classes have become different, and therefore they have much more concentrated discussion in addition to a common classes that we have. So there is a stress on the subspecialty, at the same time strong foundation through comprehensive. Some of the teaching methodologies have changed. I think instead of didactic, we want to have more case oriented. The fundamentals, what you call flipped classroom, the fundamentals have to be read by them and come prepared to. One of the setback that we faced was during COVID that the people started having classes or attend classes more from the homes and the classes away from classrooms. We are now trying to bring back the culture of coming to the classroom at 7 a.m. and being in the classroom, because that brings some discipline in life. So while that has got little diluted, we would like to see back the culture of LV Prasad Eye Institute starting their day sharp at 7.
That discipline and that, yes.
Yeah, Patodia presentations always have a special memory in every fellow's memory. That
So you were talking about blessings, right? At
Yes.
7 a.m. every day, I get a lot of
Exactly.
blessings.
No, but that has taught us a lot even later. I'm like not in a only negative way, but obviously we can kind of face any question with confidence. So that's surely something which Patodia presentations have given us.
Yeah.
So what defines LVP trained ophthalmologists today?
LVP trained ophthalmologist.
What is the definition? What would you say how LVP trained ophthalmologist
Will be different from
will
somebody
be
else.
different or should be identified as when he or she goes out?
I think what we see, while they have excellent clinical skill, both in terms of the pathologies that they have seen, as well as the surgeries that they do. In my view, the most defining things that is there is that all of them have practical experience of reconciling excellence with equity. How they can provide excellent care with compassion without neglecting care of those who need it most. And many of the fellows we see, they are practicing those values in their practices also. Number two, the exposure in LV Prasad Eye Institute also make them a lifelong learner. They are able to keep pace with the emerging changes in the eye care and vision care area, and they are seen very actively participating in both state, national, and international meeting, and we feel very proud of that. The third thing that defines our LVPI fellow is their ability of questioning. I think we always encourage fellows to ask questions to visitors, experts, as well as clinical faculty. Although it is becoming less, but they still are playing very active role in terms of asking questions frankly and getting more clarity. So some of those who are into the institutional practice are able to translate those questions into research. And we see that many of our alumni are leading eye care organization in
Correct.
different parts. So they also are able to realize that it is a social responsibility more than a profession to earn money that they are able to demonstrate. So some of our alumni are really playing very active role in ensuring eye care is available to all those who need it.
Yeah.
And we are very proud of all of them.
Yes. Dr. Rao, speaking of leadership, you have been a global leader. And as they say, a true leader is one who not just creates followers, but creates more leaders. And you have shown how you have created leaders along with you. How did you manage to do that? And what were the core values that you always wanted to pass on to the next generation of leadership?
I think one thing we did was right from the beginning, after looking at examples again in the West and particularly in the US, it was clear most successful hospital chains and hospitals in America were physician-run hospitals, where the leaders were physicians. So we have decided our institute will always be a physician leadership. And to that extent, in a simple steps we have taken from the beginning, like each faculty member, we try to give them a small area of administrative responsibility. And we see how they progress. Depending on the progress, they move up the leadership ladder.
Oh.
Those who have special aptitude, we send them to courses, we send them to different things and exposure. And then that's how we build the pipeline of leaders. That's how we were able to do succession planning quite well and make the succession happen very well. And behind this group is another group of 35 to 45 age group, a lot of potential leaders. So there is always a pipeline, and we've been very fortunate that way.
Absolutely. Dr. Prashant, how does it feel to carry forward such an extraordinary legacy?
I think while I feel very proud of being given this responsibility, I very much understand the weight with which this responsibility comes. But one thing that I have always believed into, that the organizations such as LV Prasad Eye Institute have and have to continue to play a leadership role in the field of vision impairment and blindness. And toward that, it is important that uh, we continue to remain a responsible and responsive organization. So I think that's a big responsibility, because it demands not only preserving values inside, but also being aware of what is happening around the world, where are the needs, and how you develop your strategies to address those needs. What are the changes happening in the field of eye care, and how you adopt those changes, particularly with regard to in the context of our geopolitical realities. So I think that is what is the responsibility that I have taken. And we have certain plans to ensure that we continue to remain a responsive organization.
Yes, and
Just
there will
one
be more
question.
challenges ahead, Aditi.
Yeah. What do you feel are the challenges ahead now in ophthalmology? Would like to ask both of you.
No, I think despite whatever progress we have made, the problem of vision loss and blindness is increasing. And this is particularly because of the longevity, and then both the extremes of the age are, at one end, you have issues related to premature birth and newborn. And then with the growing age of the people, you will see that the issues are going to change. So one is the nature of diseases and the population that you are going to be facing is going to be the biggest challenge. Second is some of the non-communicable diseases are becoming more relevant. They have implication on um, uh, with the vision also. For example, diabetic retinopathy,
Lifestyle disease.
glaucoma, dementia even, because vision loss accelerate the risk of dementia. So the next generation of ophthalmologists will have to equip themselves to take care of these aged people who possibly may not have adequate support to seek healthcare. So how do you reach out to them and provide healthcare is going to be the next challenge that I see. A third challenge, which I partly covered in my earlier section, is which technology to adopt, how to use technology, because you have to balance between the hype created by the technology company versus their true value in the community. So that is another exercise all the future leaders will have to do, to really not just blindly adopt technology, but to also look at the perspective in which technology can benefit. Fortunately, some of the technologies are proving very fruitful. Say, for example, teleophthalmology. The way we can upload record on the electronic, so that remote monitoring of the patient is becoming a reality today. One of our colleagues, Tapas, is able to do ROP screening using a Zoom platform, and trained technician who are directly imaging, and that image is visible on the laptop in the tertiary center. Home care is becoming a reality. Our team is going to the homes of people using handheld devices and are able to connect the experts with the patient, and then they are able to provide care directly to the home. So that reconcile or really making best use of the technology that is coming into the market is going to be the responsibility and a challenge for the future leaders. The last challenge which I feel is to keep health workforce aligned to the social need and demand is going to be a big challenge because of the paradox that we see in the community. And I think all institutions will have to not just think that they can get ready-made clinicians, support system and other things. They will have to invest into training, particularly training values or inculcating values in them is going to be a challenge. But otherwise, I am very optimistic that all of these challenges can be tackled provided we have a commitment for that.
So, with the last point, like how do we actually protect ethics in currently like increasing commercial healthcare environment with a drastic difference between remote places and metro cities? Even in smaller cities like Kolhapur, we have so many other corporates coming in. So how do we actually protect the ethics and still go ahead and progress?
Keep on your path. Keep walking and you reach your destination. Don't move, get pushed or pulled by anything. The one simple thing, Aditi, is if 95+% of patients that are already coming to you are happy with you, you don't have to worry about competition. And for that, if you are an excellent doctor and patients love you, you will not lose them. And they'll bring more patients. There's so much to do. There is really no competition in India. There's so much volume of problem. We are not enough. But the second thing also, next generation has to seriously think for their own good to move away from big cities. Just imagine I asked them, I challenged them, you talk of work-life balance. Why are you in the cities? You spend 2 to 3 hours on the roads commuting, and those 2-3 hours you could spend with your family.
Yes.
You are in a smaller place. You talk of quality of life. Why are you in polluted cities? Why are you not going to a cleaner areas? And to prevent your children getting all kinds of problems, health problems. So they have to understand when they talk this language, what they really mean. What is quality of life? What is work-life balance? And I sometimes ask them 24 hours, tell me what do you do in 24 hours? Nobody knows. Thing is, we are never taught to answer these questions. And I also tell them that our generation has destroyed the world. If your generation also don't repair it, there is serious trouble.
I think being in Kolhapur, like relatively smaller city, I do have the privilege of not wasting time in commute and utilizing that time for something better than just being stuck in the traffic.
Yes.
No, in our own network, we see in Hyderabad, some of our colleagues take 1 to 1.5 hours every day one way.
One way.
Right? In Vijayawada, they walk to work in 5 to 10 minutes.
One question to both of you. Dr. Rao, if you were to start LVPI today, what would you do differently? And Dr. Prashant, where do you see LVPI 5 to 10 years from now? Dr. Rao first.
I don't think I'll do anything differently. I'll do exactly the same way.
Okay.
It worked. When it worked, why should I do something differently?
Yes, absolutely.
So
Dr.
as far as the next 10 years in LVPI is concerned, I think the core philosophy is going to be preserved. But we are going to strengthen our village vision complex, our community programs, our primary eye care, and we are very actively working on strengthening those. At the same time, we are going to create institutes of excellence which can become the global resource center. We already have few established Anand Bajaj Retina Institute, very recently we started glaucoma. Shantilal Sangvi Cornea Institute is a child sight institute, Institute of Eye Cancer. So like that, we have created these institutes of excellence. Some of the new areas we are going to embrace, and these are understanding the how vision impact development of the brain or the degeneration of the brain. So we are planning to set up the Eye and Brain Institute. We are building an institute of inherited eye diseases to really understand the whole genetic makeup of people suffering with these inherited eye disease, and also exploring technology treatment for these patients. We also have set up pharmacology, so we slowly will like to expand the scope of activity toward discovering new treatment, new ways of. On the iBanking front, we want to create national program in a sense that instead of so many iBank functioning in isolation, they should work together so that nobody in our country is waiting for corneal tissue if they need a cornea for the
Really great.
restoration of sight. So that is on the front of iBanking. On technology front, we already are building few technologies in-house. Two of these technologies are already licensed for commercial, for being available to the rest of the countrymen. And we are also encouraging many of the startups and innovators to work with us and help them bringing out the products that are going to transform our country. On the advocacy front, we are working very closely with the both governmental organization as well as non-governmental organization, and will continue to play important role in bringing out policies which are going to be beneficial for people suffering with vision loss. We will continue our effort to train skilled workforce, both at an ophthalmologist level as well as allied ophthalmic personnel. We will continue to build partnership, collaboration, so that we are one of the key player as far as this global vision of eliminating needless blindness is concerned.
Absolutely. So nice to know. I think we have had such a lovely discussion, and we have come to the concluding segment of our discussion. In this, I would like to request you to answer in one line only. Dr. Rao, what is the one decision that you are most proud of?
To return to India.
Yes. Uh, is there anything that you regret, Dr. Rao?
No. You mean professionally?
Yes,
No.
yes.
Yeah, no.
Okay. Dr. Prashant, what is the one principle that guides you every day?
Making impact in the life of people suffering with vision impairment.
Nice. One word that would define or describe LVPI.
An institute that will remain relevant and impactful in future.
Absolutely. Dr. Rao, excellence or compassion, which comes first?
Compassion.
Okay. Dr. Prashant, the last question. One message to the young ophthalmologists of today.
They continue to believe in yourself, continue to keep learning and helping people suffering with vision impairment.
Dr. Rao, your concluding remarks.
No, I think in India, we have come a long way in the area of eye care, but we still have a long way to go.
Great.
And I think together, if everybody is committed, we could lead the world and set examples in the area of prevention of blindness and providing eye care to everybody, and particularly show how high quality eye care can be made accessible and available to everybody.
Thank you. Thank you so much. I think this last few 1 hour has been truly very inspiring for both me and Aditi, and I am sure to all our viewers. Thank you so much for the opportunity, for your valuable time, and the wonderful insights that you have given us. They say some journeys become milestones and some become guiding lights. But today we have witnessed a journey that does both. On behalf of MOS, we offer our deepest gratitude to both of you, Dr. Rao and Dr. Prashant, for sharing not just your story, but your soul, your vision, and the values that you have inculcated in all the people associated with you and now to us. Thank you for illuminating millions of lives and inspiring all of us. Thank you for reminding us that institutions are built not just by infrastructure, but by intent, integrity, and inspiration. LVPI is not just a center of excellence, it is a living example of what vision, when combined with compassion, can achieve. May this journey continue to inspire countless others, for when vision meets purpose, it creates a legacy. Thank you once again.
Thank you.
Thank you.
Thank
Thank
you
you
so
very
much
much.
for this opportunity.
Thank you very much.
Thank you so much. Thank you.